Hi, good morning, everybody. Thank you for joining us today for this talk this morning. How is everybody? So what we're going to talk about today is we're going to learn more about the prevention and management of lymphedema. Before I go on, hi everybody, my name is Andrew. I'm your host today. I'm also the counselor, the manager for Psychosocial Service Department in 365 Cancer Prevention Society. Before I walk you through today's talk, please like and share the video in the Facebook. Please also like St. Luke's Facebook today. So we are very honored today to have collaborate with St. Luke Hospital. So today's talk will be two parts. So we divided in two parts. One will be the talk itself, and then later we will have a live demonstration of the exercise later by the speaker. So who's the speaker for today? We have she's Miss May. She's the senior physiotherapist of Day Rehab Center at St. Luke Hospital. She also has 15 years of clinical experience in various physiotherapy fields. She is also a certified lymphedema therapist, developing lymphedema services in St. Luke, where they promote towards self-management of lymphedema. Before we go on, let me introduce you what is a 365 Cancer Prevention Society. We are a non-profit social service agency in Singapore, where cancer fighter fights, caregiver find support in their fight with cancer and learn how to prevent and cope with cancer. The society achieves our threefold mission of our society through cancer prevention, cancer fighting, and cancer education through the 6 services provided to our beneficiaries. Through the psychosocial department, we have care and concern team, counseling, nutritional support from dietitian. We also have 3 social service centers. The locations are in Ang Mo Kio, Bukit Panjang, and the upcoming in Clementi. So you might ask me, what does the social service center does or do? So basically, they organize physical exercises, activities such as art and crafts, or like Restora, Zumba, through Zoom. Currently, we are conducting through Zoom lah. So before the COVID, they actually have a centers where the members go down to the center. So and also health talks. So without further ado, let us invite Miss May on board to kickstart the health talk. Hi, Miss May.
Hello, Andrew. Thanks, Andrew.
I shall pass the time to you now.
Hi, good morning, everybody. And thanks 365 CPF for inviting me. And also, thank you everyone for joining us today for the talk about lymphedema. So basically, today's talk is about for me to give you the ideas on how to deal with lymphedema and how to prevent it. So before we go to management of lymphedema, let's start with understanding what is lymphedema. Lymphedema is the swellings of a body part caused by increased fluid in the tissue under the skin. And lymphedema results due to the inability of the lymphatic system to remove fluid from the tissue of a certain portion of the body, or when lymphedema nodes are damaged. So this can be gradual or can be sudden onset. So depending on the lymphatic impairments, people can develop lymphedema anywhere in the body. So it typically appears in the extremities like arms and the legs, where it may be on one side only or both sides of the limbs. But lymphedema can also affect the trunk, chest, breast, genital area, and the head and neck. So it is important to know what is our lymphatic system and how the lymphatic system functions. So now let's take a look at our lymphatic system. Lymphatic system presents throughout the human body and consists of lymph vessels and a number of organs. In the picture, you can see the lymph vessels and cluster of lymph nodes at the different area of our body. So this is the cervical nodes at our neck area and the axillary nodes at the armpit area, and we have lumbar lymph nodes, pelvic lymph nodes, and the inguinal lymph nodes throughout our body. So it is interesting to find out the function of the lymphatic system. And what is lymph nodes? So lymph nodes are round, kidney, or bean-shaped lymphatic organs that filter away harmful materials such as cancer cells, dust, darts from lymph fluid. And it is a storage place for white blood cells, lymphocytes, and serve important immunological functions, which mean they fight against harmful materials. Okay, they help to fight, destroy, and eliminate the harmful materials from the body. And what about lymphatic vessels? The vessels collect the lymph fluid from the body tissues and drain it into the blood after it had passed through the lymph nodes. And what is lymphatic flow? Lymphatic flow is the flow of the lymph fluid in the entire lymphatic system. A clear, colorless fluid called lymph passes through the lymph nodes in your neck, under your arms, and in your glands, and return to the circulation just before the blood enters the heart. So if the parts where the lymph travels through are damaged, fluid can build up in the tissues, which results in swellings in the affected area. Lymphedema can be classified as primary and secondary lymphedema. So what is primary lymphedema? Primary lymphedema develops due to the abnormal development of the lymphatic system. It can be further classified as well, depending on the age of onset. What about secondary lymphedema? Secondary lymphedema is caused by the removal of or damage to the lymph nodes. A single largest cause of the lymphedema, secondary lymphedema, is due to the cancer treatment. Other additional causes can be malignant lymphedema, which is like obstruction of the lymph tracts by tumor cells, injuries, surgery, joint replacements, burns, scars, and obesity. It is interesting to find out how the cancer treatment caused this lymphedema. Lymphatic system can be damaged due to cancer treatment by when the surgery removes the lymph nodes, or when the patient have to do the radiations on the lymph nodes or to the area of body where the lymph nodes were removed. When the surgery removed, it may also remove the lymph nodes or some of the vessels that carry the lymph fluids. So this can cause the fluid to build up in surrounding tissues under the skins. Radiation treatment can also damage nearby tissues that may include lymph nodes or lymph vessels, resulting in too many lymph fluid in the tissues. Once you have had surgery or radiation, you are at risk of lymphedema in the affected area of your body for the rest of your life. Lymphedema may develop any time after your treatment. As you can see in this figure, quite a number of lymph nodes will be removed during the surgery. So you may want to know whether you are at risk of lymphedema, getting lymphedema after the breast cancer treatment. So let's take a look at what are the risk factors for breast cancer-related lymphedema. So axillary lymph node dissertions is the strongest risk factor for lymphedema after the breast cancer treatment. As the removal of lymph nodes impair the lymph system, as you may know now, as you can see in the figure, the area of the tumor and tissue removed includes some of the lymph vessels and lymph nodes. And another one is the auxiliary radiation therapy. It's also a significant risk factor for developing lymphedema. Being overweight before treatment or gaining excess weight after the treatment can increase the risk of lymphedema. Okay, so it's very important to know what are the signs and symptoms of lymphedema. Swelling. So in general, the swelling gradually increases over time. Many patients will be aware of the swelling until it becomes significant. Patients may report that they have had lymphedema only for 6 months, but clinical presentations and the appearance of the lymph may suggest the swelling has been there longer. And there will be a feeling of tightness, fullness, or heaviness at the affected area or affected limbs. And you will be able to find pitting edema on the area. So what is pitting edema? When you press the skin, a temporarily small pit with forms, it is called pitting edema. Pitting varies depending on the stages of lymphedema. The depth of the pittings is the indicator of the amount of fluid present in the tissues. And then patients commonly complain of achiness and the feeling of tensions. They may also complain about pain, but the severe pains that requires medications is rare in lymphedema and may indicate the presence of cellulitis, recurrent cancer, or nerve issues or bone and joints issues. And the patients may have trouble using the affected area when you do the daily activities and exercise, because the swelling will limit the joint range. And you will notice the skin changes. So in later stage of lymphedema, there are significant skin and tissue changes, some of which can be extreme and quite disfiguring. So these changes are typically more profound in the lower extremities than upper extremities. So lymphedema can be divided into stages according to the disease progress. There are 4 stages of lymphedema. So it usually progresses through a series of stages such as stage 1, 2, 3, 4. That's why it's important to get help right away, even if the initial symptoms don't really seem like a big deal, or they come and go. But one episode of like numbness, tingling, or swellings, usually you will have another episode or more. That's why if you don't act on early symptoms, the buildup of the fluids, the lymph, can cause the permanent damage to the tissues under the skin. So how does the stage 1 look like? In stage 1, which is also called like subclinical or like latent stage, there are no visible changes to the affected body part at this point. But you may notice a difference in feeling, like tinglings, unusual tiredness, or slight heaviness. You can have stage 1 lymphedema for months or years before obvious symptoms develop. And at this stage, the swellings and the symptoms are reversible with the proper care. At stage 2, the affected area appears mildly swollen as the fluid starts to accumulate. It's still reversible at this stage with treatments because the skin and tissue haven't been permanently damaged. You will also have soft pitting edema. When you raise your affected limb, you will find the swelling resolve as well. So which is like when you elevate the limb, then the swelling will go down. And the skin on the affected area, you can pinch and move easily. In stage 3, the affected area, you will see more swollen, and the raising your legs or hands, the affected area, doesn't help. And then pressing on the skins requires strong pressure or no pitting sometimes. So changes to the tissues under the skins are happening in this stage, such as inflammation, hardening, or thickening. Stage 3 lymphedema can be managed with treatment, but any tissue damage cannot be reversed. Okay, at stage 4, this is the most advanced stage. The affected limb or area of the body becomes very large and misshapen, and you will notice skin hardening, and there will be no pitting, and the tissue damage under the skins are not reversible. So how do we diagnose the lymphedema? Diagnosis process usually starts with getting thorough medical and surgical history. So your lymphedema practitioners or the doctor will get the full medical and surgical history from you, because it is important to know what types of treatment the patient have had for their cancer, or whether the lymph nodes are removed. For the subjective complaints, the detailed information of patient subjective complaints is important to diagnose lymphedema accurately. Lymphedema practitioner will need to know your subjective complaint like pain and your 24-hour pain pattern, like when your pain get worse, and in what time of the day your pain is better, and how your functional mobility is affected currently compared with before you get the swellings. Yeah. Then for the physical exam, doctor or lymphedema therapist will conduct thorough physical examination to find out the stages of lymphedema and signs of lymphedema. But how do we measure the edema? So there are many ways to measure the circumference of the affected area. Most importantly, and most commonly and easily, a tape measure is used to take circumferential measurements of the swelling. Usually, measurement is to determine a difference between the affected limb and unaffected limb, or any asymmetry between the limbs, or to monitor the effectiveness of the treatment, outcome and progress of the treatment. So lymphedema therapists will measure the size of the limb at the first visit and monitor progress by measuring at a specific interval. For example, maybe like first visit and after 10 treatment sessions, so they can see the outcome of the treatments. For the imaging and scan, there are various imaging modalities can be used to assist with the diagnosis of lymphedema or to rule out other disorders. Your doctor may order appropriate imaging tests to get a look at your lymph system. So now let's go into the management of lymphedema. The goal of the management of the lymphedema is to relieve the swelling. However, the ultimate goal is to enable the patient to self-manage and control this condition in longer term. So why lymphedema care is important? Lymphedema care is important because it is a condition that can worsen over time without proper care. Treatment at any point along the course of treatment is effective because the early treatment makes for better outcomes over the long term. Following recommendation of treatment techniques strictly is essential, even though they are often uncomfortable, inconvenient, time-consuming, but the treatment will last throughout the lifetime of the individual to maintain. There are basically two phases in the management of the lymphedema: the intensive complete decongestive therapy and the maintenance self-care phase. Complete decongestive therapy, CDT, is an important multi-component treatment. Currently is the gold standard for the treatment of lymphedema. CDT includes start with patient education and then manual lymphatic drainage, compression bandage, exercise, and skincare. So lymphedema therapists will teach the patients self-care in this phase so that the patient can be ready for the next phase to for the maintenance self-care. At the phase 2, after the completion of the intensive phase of CDD, patient will be responsible for self-management. And patient need to be educated on proper exercising and how to perform self-MND if required, or how to apply bandaging and how to don and doff compression garments if needed. And patient need to be educated the importance of the follow-up visits. So the first important part of the CDD is the skincare. Skin is the largest organ in our body and our biggest defense against infection. Lymphedema puts the person at a higher risk of infection in the affected area. That's why it is essential to make sure the skin is not broken and protected from any damage. So to protect your skin, daily moisturizing is important, and then protect yourself from insect bites or protect yourself from getting sunburn. Treat skin breaks. So if you do get any kind of break in your skin, make sure to treat it right away. Then when you cut toenails straight across to avoid the ingrown toenails, and then seek the advice from the podiatrist if needed. And most importantly, know the signs of the infection. Any break in your skin on the affected area, such as scratches, burns, or punctures, will lead to the infection, might lead to infection. So what are the signs of infections? Redness, swellings, and then the area of redness getting bigger, and then warm or hot when you touch, and then you will feel a bit of pain and tender. So if you have any symptoms, any of the symptoms that I have mentioned just now, then you go straight away to your family doctor or a clinic, or if it is severe, go to A&E. MLD is the important part of the CDD. So what is MLD? MLD is a specific type of gentle massage that helps move lymph fluid out of the tissues and into the lymphatic system so that it can drain normally. So usually it helps fluid away from the affected area, then routed into the healthy lymphatic regions and lymph nodes. So lymphatic massage is very different from the deep muscle massage. So in the figure, you can see the direction of the strokings when the lymphedema therapist to perform the lymphatic massage. These are the pictures of before and after treatments of the CDD. Okay, the third important factor of CDD is bandaging or garments. So in the compression can be by bandaging or by wearing garments. So your lymphedema therapist will recommend you the appropriate kind of compressions. For the compression bandage, it helps move the fluid in the direction towards the heart by supporting the skin and tissues. It also improves the efficiency of the muscles and joint pumps. The goal of bandaging is to reduce the size of your arm or leg. Once the size of the arm or leg is reduced, it will be ready for the next stage, which is compression garment. But compression alone does not help, does not adequate for the management of lymphedema. Compression therapy must combine with MLD, manual lymphedema drainage, to receive the good outcome. So for the compression garment, it is to maintain the size of the affected area. So it can be fitted After the swelling has stayed the same for a period of time, and then later with the compression garments, it will maintain the size of the affected area. Usually the compression garments are made with the fabrics. The fabrics puts a control amount of pressure on different parts of the arms or legs to help move fluid and keep the fluid from building up. So a comprehensive exercise program for the important part of the lymphedema therapy is exercise. Comprehensive exercise program for lymphedema should include diaphragmatic breathings, the active range of motion, strengthening exercise, aerobic training, and stretching exercise. Together with the pressure garments, different types of exercise benefit patients with lymphedema. So decongestive exercise will help the lymph flow. So these exercises are usually done with no weights or no resistance. And then basically the therapist will teach the patient how to do the decongestive exercise properly. And for the muscle strengthening exercise, which is the resistive training, it improves the muscle strength and power. So when the muscles is stronger, it can help reduce the amount of swellings and further prevent from the further injuries. And increase the weight gradually one step at a time by following the therapist's prescription. Flexibility or stretching exercise will also help you improve flexibility for your everyday movement. Examples of the stretchings, flexibility exercise may be like daily gentle stretchings or doing yoga, qigong, tai chi. The next one is aerobic or cardio training. Aerobic exercise increase our intra-abdominal pressure, which helps pumping the largest lymphatic vessels in our body. So that's why aerobic exercise are important part of the exercise routine. Activities like brisk walking, biking, and swimming all can provide the cardio training. And swimming, yes, swimmings, water exercise and swimmings help the flow of the lymph fluids and blood. So gentle movement in the water will stimulate the muscles and skin movements without stressing other body parts or joints. I'm going to show you a series of simple and easy exercise for the arms and the legs. So later my colleague will show how to perform those exercise. You may follow to do it together with us. So before all of the exercise, take a moment to check your posture. Sit on a chair with the feet together on the floor and then align your body. Your head and your shoulder should be aligned, either in the sitting position or the standing position. So before we start exercise, the first step of the exercise is belly breathing. So when you do belly breathings, basically you will inhale and exhale. So when you inhale through your nose. And then when you exhale through your mouth. So we will do 5 times for today's demo. 1, 2, 3, 4. When you exhale longer. And 5. Okay, now we're trying to do the exercise for the arms. So this is a series of 6 exercises for the arms and for the hands and the arms. So we start with the hand exercise. For the hand exercise, make sure your body posture is correct, and then your hands open and close your hands 5 times. Yes. So you start with one side and then proceed to another side. Okay, for number 2, you will move your wrists forward and backward. 2, 3, 4, 5. And then we go to the next hand. 1, 2, 3, 4, 5. For the elbow exercise, bend and straighten your elbow. 1, 2, 3, 4, 5. The other hand. 1, 2, 3, 4, 5. Then you will proceed to the shoulder exercise. Roll your shoulder in a backward direction. 1, 2, 3, 4, 5. And next, lift your hands up towards the ceiling and lower back down. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. The last one for the arm is for your arm to raise from your side up above your head and gently lower back down. 1, 2, 3, 4, 5. Now we will show you how to do the exercise for the foot and the legs. So the first one is roll your foot in a circle. You start with one direction 5 times and then change the direction. So repeat in the opposite direction. 2, 3, 4, 5. 1, 2, 3, 4, 5. Second one is for the heel to lift up and down. So you raise your heel up and down. 3, 4, 5. Okay, the third one, you will lift your leg up and down. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. For number 4, you will stand up And then make sure you hold something firm with one hand or two hands. Depends on how much assistance you need. And stand with a good posture. And then lift one leg up as high as you can by bending your hip. And then slowly lower back down. 2, 3, 4, 5, 1, 2, 3, 4, 5. For the next, you bend your leg, lift the leg up. 1, 2, 3, 4, 5. Okay, the last exercise for the leg is lower yourself, bend both your hips and the knee, and slowly stand up. 1, 2, 3, 4, 5. Thanks, Joanne, for demoing the exercise. So you may want to know what are the things to look out for when you do exercise, whether you are doing exercise appropriately. So when you start the exercise, remember to start slow and then increase the time and intensity one step at a time. Then wear your compression garments while exercising, and then watch for aching or a feeling of fullness during and after the exercise. This could mean that your lymphatic system cannot keep up and you need to lighten your exercise a bit. And avoid exercising under the hot sun. And stop exercising if there is a pain or when you feel very, very fatigued. And watch for any discomfort and tell your doctor if you feel discomfort, and then will not recover after you rest also. So you can modify some of the things, like let's say if you have upper body lymphedema. So during your daily physical activities, like for example, carry your bag over the non-affected area, or you use the wider strap on the handbags and backpacks, and wear the bra with wider straps that fits well, and avoid carrying heavy items or doing repeated motions. So because that may slow down the lymph flow from the arms to the body. So it is important to know risk reductions for the lymphedema. So when you have the lymphedema, or if you are at risk of lymphedema, it is important that you go for your medical checkup regularly, and then report any changes on your body, like change in size, change in sensation, color, or the temperature, or the skin condition. And then measure body weight regularly, maintain normal body weight, and then seek professional help to lose weight if needed. For the exercise, follow recommendation on the exercise for lymphedema, and consult and discuss with your therapist. If you're already wearing compression garments, wear compression garments appropriately, and then knows the signs of infections. The infections and the cellulitis is the urgent medical situations. And then most importantly is skincare. Avoid excessive or prolonged constrictions of the affected body part, or for example, wearing very tight clothing on your upper body. And let's say if you needed to go for the surgery, inform your surgeons of your risk of lymphedema or whether you have lymphedema. And then avoid sitting or standing for a long period of time without moving or changing positions. Okay, this is the end of my talk. And you may want to know where to get help for lymphedema management. So if you're staying in the West, St. Luke's hospitals have the lymphedema outpatient service at the day rehab centers. If you are staying in the other parts of the Singapore, you may go to the acute hospital like SGH, NUH for their lymphedema clinics. Now I would like to pass the talk to the Andrew.
Hi. Hi, thank you, Miss May, for the presentation, and Joe for the demonstration of the exercise. So I guess, yeah, if some of you want to do you want to follow through the exercise, you can review the video later again, and then you can actually do with Joy in the video. So next session will be some question and answer session. So you have any questions that you may want to ask Miss May, you can comment in the Facebook link below, like, for example, like, when I exercise, do I need to put on the pressure garment? If it's itchy, how? So stuff like that. So also would like to know how many of you today attended this talk, right, are actually suffering from lymphedema. And also a shout out to good morning for those who have just joined us the talk just now. And good morning to Miss Eleanor as well. Okay, that's actually a first question posed by one of our participants. Miss May, so she was wondering if there is a cure for lymphedema.
Generally, there is no total cure for lymphedema, but with the early treatment and early identifications of the swellings and the symptoms, the lymphedema can be managed and can be well under control. So there are many ways it can be treated. Yeah.
Okay.
Yeah.
Okay, so there's also another question. I think let's see. I need to scroll back. Yeah. So you mean ask, can we get lymphoma even after a period of time after surgery?
You mean lymphedema? Yes. So if you are
lymphedema, yeah.
If you have cancer and then you have the cancer treatment done, completed, like surgery, radiations, you are at risk of getting lymphedema. So anytime after the treatments, you are still at risk of lymphedema. Yeah, so that's why it's very important to know how to maintain and prevent to reduce the risk of getting lymphedema.
I see. Okay. I think just now previously, SK Ong actually asked if I have hand upper limb lymphedema. Does leg exercises means they are not applicable? I think Jolene did mention that yes, upper exercises may actually be more beneficial in this case. So this is my question. So does it mean that she don't need to do lower limb exercises at all?
So, thank you, Jolene, for answering that also. Like what Jolene have mentioned, it is more important for you to do upper limb exercise, but exercise is like a comprehensive program. So, not only the upper limb exercise, the exercise involve the whole body will benefit you. Yeah. So, but more importantly, you have to focus on the upper limb exercise.
I see.
Yeah.
So there's actually another question. Hi, Miss May. Is it safe to exercise when I have lymphedema?
Yes, definitely. So exercise is safe with lymphedema as long as you follow your therapist's recommendations. Therapist will prescribe you a set of appropriate exercise for you to do daily. Then after that, therapist will guide you along to progress. What is the next and progress accordingly. Yeah.
I see. I think a lot of times, right, like just now when Miss Joy is demonstrating the exercise, right, it looks pretty easy, but when you are suffering from lymphedema, it's not, I guess it's really
Yes.
not that easy now. That's why they ask whether is it really safe to exercise
Yeah,
when you have
definitely.
lymphedema.
Yes, correct.
Okay, so there's another questions by Shalom. If my left arm is affected, do I avoid sleeping on the left side of my body and try to lie towards my right side? That means his left side has lymphedema. Do you recommend that he sleep on the right side? And also, does he need to lift up his hand on a pillow to let the water flow down towards the heart when he sleep? What is, yeah, he has quite a fair bit of question.
Thank you for the questions, and it is a very good questions. So if you have the swellings at one side of your arm, so it is better for you not to press on that side for a longer period of time. So definitely it is better to sleep on the non-affected side if you need to sleep in the side lying positions. But like for like 10 to 15 minutes or 30 minutes is should be okay. But it's just that avoid presence on that side for a longer period of time. And then for the lifting the arms up to reduce the swellings, it depends on how big your swelling is and what is the stages of your lymphedema. So if you have really obvious swellings, it's not that you need to lift up your arm all the time, but definitely you don't hang your hands throughout the day. So there will be a time, like let's say if you are sitting in a position for like more than 1 hour, and then you feel a bit of tightness on your arms already, then you're trying to lift up for about 30 minutes. Yeah. So then after that you can bring your hand down and then do your usual movements, and then again maybe after 1 or 2 hours or like at one point of the day, then you can lift up. Yeah.
Okay. So there's another question. I think a lot of people who are experiencing lymphedema, right? Usually they will ask this question as well. So if I have a lymphedema on the left arm or right hand, let's say lah, and then what if I get an inside bite on my lymphedema limbs and it gets swollen? What kind of besides applying the ointment, what else can I help? Will it help with the inside bite?
So
My arm is already swollen and then I got an inside bite making it worse.
yeah. So if you have the insect bites and then the skin is broken, so the important part is to heal the broken skin. So it is better for you to go for the dressings, proper dressings, so that the wounds or the broken skins heal properly. Yeah. So because if we have the opening on the skins, this is the attractions for the infections to come in. Yeah. So we treat the broken skin area first, and then after that, then can continue with the other exercise.
I see. So meaning we it's actually not advisable, right, to anyhow apply ointment if there's a broken
Yes.
skin after the inside bite.
Correct. Yeah.
I see. Okay. So I hope we answer your question. And moving on. Okay, so Mr. Leslie actually asked a question. How long will the timeline be after radiation? Will one need to take note of possible onset of lymphedema? So I guess his question is asking about after radiation, what would be likely how long will it take to form a lymphedema?
Thank you, Mr. Leslie, for the questions. Actually, there is no specific timeline. That like after how many months you are at risk of getting lymphedema. So after you get the treatment done already, then you're considered at risk. Yeah. So it's important to just follow what your lymphedema practitioner recommend you, or your or your therapist. If you're already seeing therapist for exercise and all that, then follow the recommendation. Yeah.
Okay, so I think Julin also add on that the first symptoms is heaviness and sign of chronic swelling, huh? So that doesn't really goes away.
Yes,
So
correct.
Okay, so Yuko actually asked another question. But whenever she exercised, right, her swelling got worse. How should she deal with it? So maybe before we answer the question, maybe we would like to ask Yuko also. When you exercise, right, were you wearing a pressure garment? Is that appropriate? Is that a good question to ask as well?
Yes, yes, yes. So
Okay, so yeah, maybe while we wait for her to respond, maybe you can advise whether wearing and not wearing of garments, if her hand still swells, what would be your recommendation?
So when you do exercise, let's say if you have the swelling at your legs, the lower limb lymphedema, and then you exercise, and then you notice that your swellings gets worse, or your legs become bigger. So you may change. I mean, the first thing is, of course, definitely good to go and consult your therapist. And then but you may definitely discuss with therapist, and then but you may be doing exercise, but your position throughout the day uh, can check whether you are in standing position for a longer period of time, or sitting with your leg hang throughout the day. Will that be a cause of your legs getting bigger? And like what Andrew have mentioned, yes. So whether you are wearing your compression garments when you're doing the exercise, those are the questions that we can ask ourselves. Then, because if you're spending your day throughout the day in the standing position at your work or at home, and then the chance that your legs become bigger and bigger towards the end of the day is higher. Yeah, you will
I see.
notice that in the morning when you wake up, your legs is smaller. Yeah.
I see. So how about what if it happens on the arm after she exercise, but it's still swollen, or it gets even more swollen?
So for that one, maybe the exercise, you really have to go back and check with your therapist whether the intensity and the amount of the exercise, the repetition of the exercise is right for you and appropriate for you. Yeah.
Okay. We actually have a few participants asking similar questions, so I collate together, huh? So I think they are actually concerned after like several years, will they still experience? Let's see what they're asking. So maybe they say after surgery, especially after surgery, 2 to 3 years, even up to 10 years, is there a chance that they will get liver edema?
So to my experience, I mean, it can get after let's say a few years, until a few years. But even after 10 years also, there is a chance, because your lymphatic system at one point of your surgery, your lymphatic system is affected. So at any point in your life, there is a chance that you will get the lymphedema. Yeah.
I see. Okay. I think Jolene answered a very interesting comment there. So it's about pressure garment. Where can you wear and where other places are not really recommended? For example, that's pretty new to me. For example, we go swimming. Is it advisable to wear pressure garment? What if we were to wear it? What will happen?
So for the swimming, definitely we don't need to wear the pressure garments. Yeah, because when you are in the water already have the resistance applying on our skins. Yeah, and then the water is called water pressure. yeah, it will be on our skins already lah. So then the water will assist you with the exercise. I mean, the quality of the water will assist you with the exercise.
I see. So now, I think the swimming pool is open. So some of the participants will want to go and swim. So that I think that's quite a legit question whether we want to wear a pressure garment to the
Very
swimming
good
pool or not.
question. Yeah, good question.
Yeah. Another question: what if the my pressure garment is tattered or tear? How am I supposed to repair my pressure garment? Because one pressure garment is not cheap, right?
Yeah, definitely. It is
Can I
expensive.
sew back myself or something?
Actually, actually, it is not recommended to sew on your own because the garments they put a certain amount of pressure and then the size is fitted for you. So let's say if you sew on your own, then the pressure area might change. Yeah, so it's better to go back to the supplier or to the hospital that you get the garment. Yeah, and then maybe you might have to get a new one if they cannot repair for you.
Okay. So there's actually a question relating to the pressure garment. Can they wear? Let's say they don't have lymphedema lah. I think Jocelyn, your question is maybe I don't have lymphedema, but can I wear the pressure garment to prevent as a preventive measure for lymphedema?
So actually, for that, there are still how do you say no consensus in the research also, because some of the research say that it is beneficial to wearing the garments to prevent for your legs to get swollen, but some of the research say that there is no difference. So still there is the controversies lah. But it's just that maybe like for the longer period of time, let's say if you are going to take a flight like for longer durations and you know that you are at risk, then maybe like the light pressure garment may be helpful for you. Yeah.
I see. Okay, I also saw Julian additional comment. Yeah, she mentioned swimming is great. She actually highly recommended. But I think it's a good point. If you have broken skin, then probably you don't want to go into public pool lah.
Yeah, definitely. Yes. Yes. Thanks, Julie.
I think one last question that we can answer because due to the time constraint. Shirlene actually asked, is it recommended to do a LVA surgery to treat early lymphedema, or permanent exercise is actually good enough? I think LVA is like a bypass kind of lymph nodes, right?
So, for the, what kind of surgery you might need, to cure the lymphedema and all that. All those things is like, for the surgery part, right? It's better to consult with your surgeon or your physicians. Yeah.
Okay. So I think I have a last question as well. What if I'm like kind of sweat during the exercise when I wear the pressure garment? I have kind of rashes, and it became like paradoxical. I wear also cannot. I don't wear also cannot. How?
So, yes, that's why it is important for you to have a few pairs, maybe at least two pairs lah. Two pairs of the garments, two pieces of the garments for you to change. And then it is important to wash your garments, maybe like 2 to 3 times. After 2 to 3 days, if it is not so get dirty. But definitely if it is wet and dirty already, then definitely you have to change to another pair. Yeah, so it's better to have at least 2 to 3 pieces of the garment. And
I see. Okay.
And follow the instructions of the manufacturer lah. Yeah.
Okay. I think Jolene also added one more about nutrition regarding diet. So she mentioned there's actually no specific food or no food that target the lymphatic system, but she also suggests to avoid fatty or oily foods. So she say the fatty or obesity issues does increase the risk of lymphedema. Is that right?
Yeah. Thanks, Jolene.
Okay. So maybe the last question is just now during the exercises, right? Is it also suitable for elderly? Usually they have both limbs, right, legs, right, especially swelling.
Sorry. What is your question again?
Okay, so the question was just now during the demonstration of the exercise. So is the set of exercise also suitable for elderly who has both legs swelling, bilateral leg swelling as
Oh yes, definitely it is suitable for elderly or the younger population. Yes.
well?
Yeah.
So for those who have leg swelling, besides while you are lying on the bed, raising up your legs, so you can also try to do the lower limb exercises also. So I hope it's
Yeah.
helpful as well.
Yes.
Okay, so yeah, so there might be some other questions that we are unable to answer, but don't worry, you can always post a question to us offline, and then we will get maybe Miss May or Jolene to answer the questions. So
Sure.
let us put our hands virtually again to thank Miss May, Joy just now, who is the demonstrator, and Jolene in the Facebook comment.
Thanks, Andrew.
Thank you, Miss May. Yeah. So although there's currently no non-cure for lymphedema, but there's techniques and ways to help you cope with lymphedema. So just now Miss May has mentioned skincare, MLD, which is the gentle massage, compression garments, exercises. Actually, there's a lot of types of exercises, like water exercises. I first time I hear. So in 365 Cancer Prevention Society, right, we also have a lymphatic detox exercise. So some of I think the participants today, they actually been other instructors, or they are the participants who have also participate in it. So you can also put comments about how you feel about the exercises, whether it's helpful for you or not. But last but not the least, it is always very important to know where to seek for help and learn how to cope with lymphedema. Okay. And today, I think all of us has learned also how cancer treatment actually can cause lymphedema. And we have learned various ways of prevention and management of lymphedema. So thank you for everybody today to attend with us this health talk. Before I end the talk, maybe I'd like to publicize on the following health talks in the subsequent weeks. So before I talk about the subsequent health talks, please remember to like and share the video so more of us can benefit from the talk and get to know what kind of exercises to self-manage lymphedema. Okay, so remember to like and share. So next, I would like to talk about the subsequent health talk that we'll be conducting. So on the September the 19th, we are very privileged to have invited 3 cancer survivors to share with us their cancer journey, the challenges, how they overcome some adversity in their lives. So this talk will mainly be in Mandarin. So the Chinese topic is 我们的故事，so 是3位那个生命斗士啦，他们分享一下他们的经历。so 是晚上8点 so it's at 8 p.m. So hope to see you guys there as well. So the next one will be on the 26th of September. This is another quite specialized topic. So we have collaborated with Icon Cancer Center, where Dr. Lee, she will talk about the breast cancer in young women. A lot of times we didn't really recognize about fertility and family planning, especially for breast cancer in young women. So I guess this is a good topic for those young women with breast cancer. So I encourage you to participate and join this health talk as well, and share the links with them as well. So I hope to see you guys on the subsequent health talks, and thank you for joining us today for the talk, and thanks for the encouragement in the comments below. Thank you everybody, and we will see you again on the next month on the 3rd week of September. Thank you, bye.